Welcome to Wellness Health Services Health Talks. My name is Dr. Joshua Derito, family physician. Today our talk will be on cough. Cough is the forceful expulsion of air from the mouth due to respiratory causes. The cough can be classified as acute, subacute, and chronic. And it can also be dry cough or can also be productive cough. When we talk about an acute cough, it's a cough that has lasted for less than 3 weeks. Subacute cough is a cough that has been there between 4 weeks to 8 weeks. And chronic cough is a cough that has been persistent for more than 8 weeks. There are various causes of cough which can be classified in various ways. We have viral infections like the common colds, influenza virus, and the common flu. We have allergens like pollen. Some foods can cause cough. We have environmental irritants like smoke, odors from various things. Then we have airway obstruction, conditions like chronic obstructive airway disease, acute asthma. Then we have gastroesophageal reflux disease, can cause cough due to acid reflux, and this happens usually when lying down. We have medications like the drugs we call AC inhibitors, the drug that aid with the pril. We have lisinopril, enalapril. Those ones can cause chronic cough, especially in patients who are hypertensive. We have postnasal drip, which is caused by sinusitis or allergic rhinitis. And you have persistent dripping of mucus on the posterior part of the throat. Then we have respiratory tract infections like pneumonia, which can cause persistent and usually cause acute cough. So the treatment of cough is usually dependent on what is the cause, and usually we have self remedies which individuals can use to try to suppress the cough. The common ones being you can use warm salt gargles. They can help suppress the cough. Sometimes tinctures made of honey, they help suppress cough. Then you can also have warm water mixed with ginger and honey. These are common home remedies. We have cough suppressants. Usually, just before I move on, honey can be used, but it should not be used for children less than 1 year. Can cause serious anaphylactic reactions. So for kids more than 1 year, you can use half a spoon, but for children who are less than 1 year, honey is completely contraindicated. Then we have cough suppressants. Again, these are not very much encouraged in children less than 5 years because the complications are more. We have cough suppressants, and we also have, there are two types. We have expectorants, which help to express the mucus and they try to loosen the mucus and make the cough easier. We have cough suppressants. These are drugs that you use that have various components like dextromethorphan, codeine, and they have cough suppressant effects. Then good hydration, being well hydrated helps the mucus to be easily expectorated, and also helps to reinvigorate the body. Then you have humidification, whereby you use steam to try to loosen the mucus and also help with the expectoration. I've talked about honey. And then for coughs that are caused by various allergens, then the easiest way to deal with those kind of cough is to avoid the triggers, things like smoke, the allergen, and then also having adequate sleep helps to relieve the symptoms of distress from the cough. So enough rest and also self-care. So some of the things that you can do to avoid the cough is avoid triggers. Of course, one of the commonest risk factors for cough and the chronic obstructive airway disease is smoking. For those who smoke, we highly encourage them to try to stop smoking. Cough hygiene. Cough hygiene means that when you're having a cough, you try, because some of the cough symptoms are due to common viral infections, and you try to avoid spreading them to others. So when you are coughing, you cover your mouth. Try as much as possible to use your elbow more than using your hand, because when you use your hand, then the chances of you spreading the cough to other people become very common. Then also hand hygiene, persistent hand washing, and this we have learned a lot doing the right way of hand washing, especially during the corona times. So then also some conditions like pertussis, they have vaccinations. Flus, we have vaccination for flu. So always when you know that you are at risk of some of these things, especially for people who have diabetes, chronic obstructive airway disease, asthma, then they should be vaccinated against flu to avoid recurrent attacks of flu. So when to seek medical advice? Seek medical advice if you have a persistent cough, if your cough is worsening, if a cough is associated with other symptoms like withdrawals, difficulty breathing, then you need to seek the help of a medical provider. In summary, cough is a common condition which can be acute, subacute, or chronic, or can be productive or dry cough. The common remedies for cough include saline gargles, use of honey tinctures with ginger, cough suppressants, and then also treatment of some of the allergic causes of cough with the relievers like inhalers, and then seeking the medical attention when a cough is persistent and is accompanied with other symptoms. Thank you very much. For more information and for interactive, if you have any question, you can get us from Wellness Health Services YouTube channel or through our website, or you can also engage us on Facebook and Instagram. Thank you for watching.